This training is provided by the OVID, the Office for Value and Innovation in Healthcare Delivery. This training serves as an introduction to Focus PDSA. Additional training is provided through the OVID. This training is more interactive where participants will do a hands-on activity working with an OVID facilitator. If you're interested in attending or interested in learning more about PI, visit us on CareWeb. The next step of the storyboard is to organize a multidisciplinary team. An effective team is a key element to achieving and sustaining improvements. The suggested approach is to select team members based on their knowledge, experience, and involvement in processes directly impacting the area of focus. A good-sized quality team is relatively small, no more than 10 members. Ideally, it should consist of 4 to 6 members. You may want to consider staff from different shifts and even different departments. This brings the power of leveraging a wide range of expertise in problem solving. In the clinic example, the director of the clinic is the project owner. They essentially own the clinic appointment process and have the responsibility and authority to make impactful practice changes. Additional team members include the clinic manager, who oversees the day-to-day operations within the clinic, the physician champion, who has the responsibility of ensuring any suggested changes impacting physician practice are tested and implemented, a facilitator, who is responsible for facilitating the team and working closely with the project owner to ensure project objectives are met, a data analysis rep, who can pull data to develop scorecards and pull data from the electronic health record, and lastly, the patient representative, who can provide insight on current scheduling practices and utilize best practices to ensure every patient is scheduled in a timely manner. In our example, the team has agreed to meet weekly for the next 12 weeks to further problem solve and implement solutions to minimize patient waiting time. Some helpful considerations in creating an effective team is to schedule a weekly standing meeting with all team members at the start of the project. This will enable team members to adjust their schedules if meeting conflicts occur. Data is essential to any problem-solving effort. It is difficult to know where the efforts are headed if you don't know where you've been. Collect baseline data early to ensure any changes are quantifiable. Team members should understand the processes they are attempting to change. This begins with observations, or what is known as go-sees. This task requires the ability to not problem solve or ask why the problem is occurring. This time is used to observe and see what steps are performed to complete the task. Planning with the end in mind can assist with pacing their efforts in a timely and effective manner. The illustrated project timeline is a simple tool. For example, if a project is scheduled to be implemented in 4 months, project milestones are outlined to meet the anticipated completion dates. Some other helpful hints to ensuring your team has an effective meeting. Assign a timekeeper to make sure meetings end and start on time. Being respectful of people's time instills positive behavior among team members. A scribe can assist the team with tracking to-dos and critical decisions impacting the outcome of the project. A team facilitator helps to keep the team on track and moving in the right direction. They keep the team focused on achieving its outcome by minimizing sidebar conversations and knowing when to put a discussion topic in a parking lot. Tracking attendance reminds team members the importance of their work efforts. It is okay for someone to send a representative when they may not be able to attend. Keep in mind this should be the exception, not the rule. A well-structured meeting always has a standing agenda to keep the team focused. This agenda should also include the ability to track action items from previous meetings. This may be the first topic on the agenda to cover at the next team meeting. As the meeting time ends, the facilitator may want to consider asking the team, did we accomplish what we said we were going to do? This may outline the carryover of discussion into the next meeting. Thus, this may be sequenced at the beginning of the next meeting. Another question to consider is, are we on track? Particularly with collecting and analyzing data, observing how the process works today, and other key project milestones. The next step in Focus PDSA is to dig deeper into our process under study. Since high-level observations have been completed and fine, the next immediate steps are to put these observations down on paper in the form of a process map. This can be done a few different ways. There are swim lane process maps as shown in this example, where each person who has a role in the process has their own lane. This creates a visual representation of who does what and how work flows from one individual to the next. There are also value stream maps which incorporate data measures such as process and lead times and shows how materials such as customer or patient flow move throughout a process. In its simplest form, process maps are used to bring together everyone involved in a process, start the conversation regarding the problem and opportunities, as well as make all process steps transparent. Once the process is mapped out, the next step is to identify waste. Waste can be defined as any activity or process step that does not add value to a process. There are 8 different types of waste. These wastes are waiting, rework, intellect, overproduction, overprocessing, transportation, motion, and inventory. The easiest waste to identify is waiting. This is any downtime in the process where no activities are being completed because one is either waiting for the next steps or previous steps have been delayed. Rework. In healthcare, the classic example is readmission. Anytime a process must be completed again because it does not meet best practice is rework. Intellect involves underutilizing individuals. Work to your level of licensure. Overproduction includes instances where more work than necessary is done. An example would be extra labels or procedures done on a patient with no real benefit. Overprocessing would be unnecessary work that is done on top of other work. Transportation is unnecessary movement of objects throughout the process. This can be patients moving from bed to bed or lab samples traveling to different areas before reaching their destination. Motion is different from transportation in that motion waste comes from the individual doing their part in the process. A good example is having to walk to the supply room over and over again. Inventory pertains to the storage and holding of items. Holding material that isn't required can result in expired supplies and a waste of money. The best way to identify waste is to walk through the actual process with process experts. This gives you a chance to discover wastes that are often overlooked by those immersed in the process. Once more detailed observations have been completed, data should be collected and analyzed to verify that the problem is clearly identified. This data should be related to what was uncovered and found, but specific to a certain area of the process that we hope to improve. In our example regarding inaccurate appointment time lengths, we gathered more data to see if there was a specific type of appointment that was consistently running over. Here we can see each of the visit types have at least 50% of their appointments exceeding the scheduled time frame, with OFV visits at the highest at 68%. Understanding this data helps us narrow our focus for improvement. Because OFV visits have such a high percentage of instances going over their allotted time, we feel addressing this issue would make the biggest impact in reducing patient waiting time. The final step in Clarify Current Knowledge is to write a SMART goal. This goal is crafted with your stakeholders from the initial gap analysis, observations, and data collection. Your SMART goal should be specific, with direct and definite language, with no ambiguity. Measurable in order to track progress, achievable to the individuals or groups, relevant in terms of scope and time frame, and time-based. When creating a SMART goal, it is good practice to incorporate STEEP principles whenever possible.
The Institute of Medicine set forth 6 primary aims, to which every participant in the American healthcare system must contribute. Healthcare must be safe, timely, effective, efficient, equitable, and patient-centered.
In our example, the team would like to reduce the percent of the OFV appointments that exceed their scheduled time slot from 68% to 20%.